I was an $80,000 federal hazmat truck driver, and I got laid off in the crunch. And then the accident was 2.5 years later. So I just got out of the 2-year loop and lost everything. I was going down the driveway chasing my dogs, and I hit the bridge wrong and laid the motorcycle down on the bridge. But I slid off the bridge and dropped 28 feet, face first, into the creek bed. When I got to the hospital, I had hypersensitivity. I was in incredible pain. You couldn't touch me in any way. Tom got on it and found me places to live. I didn't get it, he got it for me. The big thing that Tom's really good at is getting 2 or 3 doctor's appointments at the same day. Well, that's just impossible if it wasn't for Tom. You know, one time the pharmacy said they won't take care of it, and Tom said no. He printed a piece of paper and says, "You hand this to them." And I took it down there and said, "Here," and they said, "Oh." And I got my doctor, Dr. Lewis, who I like a lot. He's a very honest and decent guy. I tell him about everything. He manages my medical, he's the top. You know, it all comes down to him. Because of them, I have a life. I live in a nice house, and we're fed and we're warm. Before the accident, I was a bull. I'm not anymore. And I had to learn to buckle down and become a team player. And they helped me do that.
Well, I was on the street for 22 years, and so all my body wasn't in good shape, you know. I was going a lot to the emergency because I had seizures. I didn't know what happened. And you know, you go into your pants and all that, and that wasn't right, and that's what I was afraid of most of the time, you know. My arm was way down, and he gave me arm pills. He gave me food for not to eat too much salt and sweets. And he built me up on my arm. It took about, what, 6 months, you know? Because before I was like, what's gonna happen next? It's a lot better for the patient to be at home, then the nurse can come over, and instead of me coming on in, when it's something simple, I guess, you know, she can come and check on my foot, you know, like when they operated on it, and then she can check on me instead of going to the doctor, and she did a good job myself. You know, I can tell her what's wrong with me, and then she takes care of it, and she gets me the prescriptions, and I can go to the pharmacy from there. I spend less time in the hospital now than I did before. You're not afraid no more. You know, like I haven't seen my family in so long, I'd like to go visit them. You know, but then, what if I did go visit them? And then I fell down, and they didn't know what's wrong with me. And the doctors wouldn't know what's wrong with me if I went somewhere else. You know, it's the only place I'm here. And I guess I'm here till I get well. Till I really get well. Then I can travel to visit somebody I haven't seen for a long time.
It started last year, 2012, March, around that time when I was having some difficulty breathing. I had lost a lot of weight, and I thought, well, maybe I'm just not eating like I usually do. It became difficult to take more than 3 steps without stopping. And at that time, I was walking at least a mile a day. I was just plain scared. I also had a great deal of mistrust for the medical profession itself. Some bad experiences when I was a much younger child. I didn't have a primary physician. And the last time I was in a hospital was 47 years prior when I had my youngest son. So I had called a couple of other doctors that I just kind of picked out of the yellow pages. And the first thing I was asked was, what kind of insurance do you have, not knowing my age? And I said, Medicare. And they said, we'll have them call you. I've never till today received a phone call back. When I walked in, I was so afraid. And he saw that look on my face. And he gave me the biggest hug and said, we're going to get you well. I'm going to take care of you. That was the beginning of a new part of my life for me. It really was. They make me feel like everybody is involved in my recovery. It's not just the doctor, it's not just the nurse, it's everybody, because it makes me feel secure. This is a safe place for me to come to. I handle most of everything that happens in my lifetime with humor. That is how I get through life, with humor. Because I wasn't being very humorous when I first walked in here. I was so afraid. It's the ability to be strong enough to face the next step. But I have people helping me with that. I'm not doing it alone.